So I found it really interesting, and it was very similar with both the questions around survivorship as it was with the queries around these social determinants of health, is that there was a high level of awareness, a true belief and perception that they were addressing it, but a feeling of lacking the ability to really affect change for different reasons. Either they themselves couldn't do it, and in the case of social determinants, all the different stakeholders, need to be in, from the professional societies to biopharma, to patient advocacy groups. Who's there to help, because we can recognize it, but what can we do about it? And then on the survivorship, similarly, we don't have the tools. We're talking about a lot of time. In both cases, there's time and effort needed to really dig down to understand these things in our patients. And then what do we do with that information? And so whether we need more support in terms of advanced practice providers, which of course translates into the reimbursement side, who's paying for that? Do we need counselors? Do we need more doctors? But there was a similar finding that, where we had this disconnect between the awareness and the relevance and maybe more so importance of these features, and then feeling somewhat handcuffed and constrained on being able to do anything with the information once the effort was taken to obtain it. And so there's clearly a big gap there that needs to be closed. And it's not, and what makes it more difficult is to identify kind of where that responsibility lies. And to some extent it lies with everyone, because it represents deficiencies of our healthcare system that we need to be more focused on. And certainly in the world of cancer, where the focus has historically always been about treatment, now as we reshift that focus because we truly have cures, we're going to have to figure out what to do about that. How do we make sure that we're curing all those who are potentially curable? How do we make sure that those who are cured have lives beyond cure, lives beyond cancer? So I think that part of this is relevant to where we are in time, and that is we spent, literally now, getting to the benchmarking point, a half a century to 3/4 of a century, just trying to get to the point we can say, we're able to start getting ahead of cancer. And now, the list goes on and on, through earlier diagnosis and better treatment, chronic disease to cure, and that's only going to increase with cell and gene therapy. We've got to figure out now, how do we kind of move to this next era, and what are we going to do to fill the gaps that patients need?